Hi, Philip. I'm going to do a walkthrough of this section, and it may go off in little tangents. I apologize, but it's just so unconventional that I have to kind of walk through and do this. So, as I've stated, you actually start with a table with all the results, and you can organize them into sections, but there's questions on the left-hand column, and I think I've seen a table down here, distribution of pre-course experience, but this isn't how you do things, not at all. And in fact, the agree, neutral, and strongly agree are columns. They're not, and you don't need to put no response. And this isn't clear at all what this means. Just basic full VR, IVR pedagogy. Uh, it, yeah. Anyway, let me go back to see what your table says. So this table is almost incomprehensible. I mean, it's not. It's just not traditional in what you're doing. And you don't start out with, of the 15 responses, 12 immersions held overall positive sentence. That's not really how you would do this. You have to be far more methodical about going through all your questions. So this overview doesn't work. And then immersions, neutral. You can't put neutral with the negative, right? Neutrals have to be uh, and not positive. Sentiment is an odd thing, and so it's not usually the wording. You would just say, if you would say this, you 12, and I'm not even sure what this means, because did you combine a score of a whole bunch of things? So items, you can't do that without telling us what you've done. So, and you definitely can't combine neutral with strongly disagree and disagree. It has to be its own category. Uh, and then this isn't how you would do this. If you want to bring something together, you can say make a total sort of score. But I mean, I guess what you're trying to do is understand the participants who were very positive, like 8 were sort of got a 6. We don't even know this is out of 6, out of what, right? So uh, I'm not even sure what you're combining. So that has to be deleted. So to begin, a contextual understanding of the most essential factor of the survey level experience reported having was level experience. So you just actually, okay, you in a results section, you're presenting the facts, so you can't talk about what's the most important or whatever. That's not what it is. You're just presenting the facts. So you would put in level of experience, and then you would talk about the score and what that meant. Okay, and then you if you've described it this way. Now, I don't know if this is from the specific questions. Minimum. That's interesting. The responses have strongly agreed to suggest at least a minimum level experience. The suggest outlines the distribution. Um, yeah. So this is way too long and needs to be, again, separated. So the way you would do the table is you would have the table that I talked about with sections. So one would be level of experience, and you'd have only one table. So level of experience, if that's what you wanted to look at, that's fine. And then, yeah, we're not talking about interesting results and things like that. Even though Mersons shared little experience with the levels of excitement were high. Okay, that's interpretation. So that goes in the discussion. And then 2 questions were used from the questioner to ask Mersons about their feelings and excitement. So then you have to put that in your table. So excitement. Um, uh, However, The range of 5 possible responses was the same as the previous strong. However, table 4 shows that only 3 responses were used. Um, I'm not sure why that is. In total, 14 emergents felt confident using with only one. Yeah, okay. So you just have to, we know that if you say 14, that one didn't, so you don't have to do that. Yeah, so your results aren't very confusing. They need to be sectioned off. Again, this table, you don't present things like this. Um, I gave you how you present them. And then, I mean, in confidence is an important, you're interpreting here. So we don't want to be, again, we don't, that's not something you put in here. Um, again, um, we don't want to have this either. No interpretation, just the facts, ma'am, or sir. That's an old reference to a show called Dragnet. Uh, Specifically, Chris shows that 7 emergents felt concerned about the health risks. So then you have to then talk about those specifically. And again, this isn't the table. That's just the one table up. It makes life easier to do that. Uh, so no interpretation. Yeah, so this has to be done quite a bit differently, and I'm happy to meet with you to talk about that. But the bottom line is that I'm just getting all the way up here. One table and only one table. Column 1 is the question. Column 2 is strongly is you might call it negative. Column 3 is neutral. Column 4 is positive. You put 2 little footnotes on the negative and the positive, saying at the bottom that negative is strongly disagree and disagree, and you know what I'm saying. Then you have the mean, and then you have the standard deviation. And you can talk about those things because there might be a pattern there, but you don't present all 15 questions. You segment them into the areas that you want to talk about, and then talk about each. And you talk about each item because they should contribute. Each item should contribute. If you want to bring the items together as a whole, as constructs, then you can. Probably best to do, well, it'd be hard to do a Chromebox Alpha with only 15. Uh, but you making assumption that certain things are going together. So if I go down to the table way down below, I don't know the sections, but you have, this looks like experience, the first two, right? And then I believe can be valuable for learning. So that's really a learning thing. I'm excited and I'm concerned about the potential risks. Okay. So that you might just put that under general perceptions if you'd like. But honestly, that learning question kind of goes here. And so I believe extended can be used for extended periods of time. That's interesting. I'm not sure if that's more of a health thing. I'm worried that seems like a health thing. I believe can replace traditional classrooms. That's sort of a cognitive perception. I believe IVR can replace teleconferencing software. Yeah, I'm not sure these would be, and I'm not sure how AVR can be, I'm not sure how IVR can be implemented into higher education learning environments. So that's sort of the practice. I'm confident in my ability. So these actually kind of, uh, yeah, they're sort of individual that you kind of, but you can section them off in the way that you'd like to present them. So I definitely have a learning thing. This is sort of, I don't know if you want to put these as negatives and positives, if you want to do that. Um, and then these traditional classrooms and teleconferencing, I'm not sure that's so relevant to your particular thesis. And this is just a weak question. I'm not sure. Um, um, so you have to decide the constructs. And then the confident in the ability probably goes up here with sort of experience. Um, and then so you might look at experience. You might look at positive perceptions um, in terms of learning, but I don't think these. See, I believe IVR can be used for extended periods of time. It's not a learning thing. That's just. I'm not even sure what that does. So some of these I would kind of exclude, and I might even. Yeah, you've mentioned that you've excluded some of these. This is a worry, so that's a negative. Um, these things really are sort of irrelevant, I think. I'm not sure how I can be into the classroom. That could be uncertainty. I'm confident in my ability. Yeah. So that's your task.